order for the type and regulation, and medication to be added to the solution. Assemble all equipment and bring to bedside. Identify the client and explain the procedure. Organize correct and adequate lighting. Perform hand washing. Wear protective gloves. Prepare the IV infusion solution and tubing. Check the type, clarity, and expiration of fluid. Remove the cover of the tubing and IV solution. Insert the spike into the opening site of the IV container. Clamp tubing and squeeze drip. Chamber allowing the solution to flow until almost halfway off chamber. Open the clamp and allow the fluid to flow until no bubbles are visible and close the flow regulator. Suspend the IV set on the IV stand. Choosing the site of insertion. Assist the client in assuming a semi-Fowler's position. If permitted, locate for the visible vein for venipuncture. Apply tourniquet 5 to 6 inches above the site. Check the radial pulse below the tourniquet. Ask the client to close his fist. Palpate the vein. Clean the insertion site with cotton. Swabs with alcohol and rotating motion from the inner to the outer part. Allow to dry. With the non-dominant hand, hold the skin of the client. Taught to visualize the vein. Insert the catheter and initiate the infusion. Insert the IV catheter gently. With the bevel up at a 15 to 30 degree angle through the skin and into vein in one pressed. Advance IV catheter and style it into the vein until the hub is 1 millimeter to the puncture site. Once blood appears in the lumen of the needle or you feel the lack of resistance, reduce the angle of the catheter until it is almost parallel with the skin and advance the needle and catheter approximately 0.5 to 1 centimeter further. Apply gentle pressure over the vein just proximal to the entry. Site to prevent blood flow and remove the needle from the plastic catheter. Release the tourniquet. Remove the protective cap from the distal end of the tubing. Attach the end of the infusion tubing to the catheter hub. Open the clamp and regulate the flow. Anchor the needle firmly. In place with the use of transparent tape, dressing directly on the puncture site. Secure the needle with a non-allergenic tape. Apply an arm board if needed. Adjust the flow of the solution according to physician's order. Calibrate the IVF bottle and label. The IV fluid as to date and time of insertion and the type and gauge of catheter or needle used. Collect all equipment and discard waste according to hospital policy. Hand washing. Document the time and date the infusion was started, and the type of solution and medication used. Check the infusion site after 30 minutes for signs of edema or infiltration. Check the doctor's order to discontinue the IV infusion and IV medicines. Prepare all equipment, IV tray, sterile cotton balls with alcohol pickup forceps in antiseptic solution, kidney basin band-aid. Perform hand washing. Inform client of the discontinuation of the infusion and of IV medicine. Close the clamp of the IV tubing. Moisten the adhesive tape with cotton balls soaked in alcohol and remove gently. Remove the needle gently by pulling it or the IV catheter. Apply pressure on the site with the use of cotton balls and place the dressing over the venipuncture site. Check the needle or IV catheter for completeness. Discard all waste materials according to hospital policy. Hand wash. Document the time and date of discontinuation.